Health Partners is an organization that has a health plan. We also have a care delivery system. We have about 1.4 million members. And only about a third of our members go to our own medical group in hospitals. The rest of them go to contracted groups. So we have a care delivery system that we have as a part of the organization. But we really depend on partnerships across our entire region to make sure that our members get care. First of all, because we do have a care delivery system, as a health plan, we, I think, better understand what real life is like at the front line. We understand really what goes on and what's possible in hospitals. And we also have the opportunity in partnership with our own hospital system and our own care delivery system to work on new ideas and new ways of creating a transparent set of measures, which we do with them and with others. New ways of paying for care, new levels of transparency within the organization so that care delivery knows how they're performing on important areas. So it gives us that advantage. We are then, I think, able to work with the partners that we have to contract with for the rest of our membership in a way that maybe is a little bit more productive, that resonates with them a little bit more, and is more likely to create solutions that we support as a health plan that have a good chance of working. The old value propositions that everybody used and are still using in fee-for-service situations are different than the ones that we need now. There's different types of trust that you need to have between a health plan and a medical group in order to kind of step forward into new models of payment that are the proper balance between risk and benefit, so that the care delivery systems that are doing the best jobs are the ones that have the best business model. You can't just all of a sudden jump to a whole new thing and expect that to happen. You have to test those ideas. That doesn't mean you have the luxury of much time, though, and so you need to be able to make those innovations on a rapid basis. One of the things that we hear from care delivery systems is that they actually want to move as quickly to an alternative as possible, because it's a very difficult thing to be living in both worlds, where doing things that help you to perform in a shared savings agreement or a total cost of care agreement can undermine your business success on a fee-for-service basis. And so they're all struggling with when do they make that jump, or how do they actually ride both horses at the same time. We live in our marketplace with what I think are a lot of enlightened leaders on care delivery and health plan side. And so they understand the need to make these transitions and have built up some of the capabilities to understand how their systems perform well, and also how to make changes quickly and reliably, so that when they do make a decision to change the way they approach a particular problem, they have the internal expertise for the process. I think that there are elements of what we need to do that have to be scalable. Measurement, the ability to take the data from within a care delivery system or within a health plan and report out meaningful stuff. Care or payment models that you can scale up so that they can be a big force and a big signal in the market. Those kinds of things need to be scalable, but there are details that arise from the culture. We touched on it a minute ago when we were talking about the idea of how the instincts that an organization has, if they were built on a different payment model, are not going to serve them well in a new payment model. And so those organizations, health plans, I think, who can partner effectively with care delivery systems so that they can build the new skills together and actually understand what the value proposition is in a way that leads to success for both on behalf of their communities and their patients, are the ones who are going to succeed. And the idea that an organization or a state or federal government solution will apply effectively and evenly across those markets without that kind of intimate understanding of how to make those markets move in that direction is going to be not going to be effective. So elements are scalable, but the details rely on that kind of local, non-scalable understanding of the dynamics of those markets.